Carolyn and Dennis, I think whenever you are ready, we can get going.
Great. Thank you very much, Jamie. Welcome, everybody. I'm glad that you were able to join this webinar this afternoon. I did want to mention that we are recording the webinar, and we will put the recording on our website and make it available for others who are interested in seeing it at a future time. My name is Carolyn Alshausen. I'm the Executive Director of Family Voices of Minnesota, and I'm very happy to have the opportunity to bring this webinar to you. And I'd like to just take a moment to tell you a little bit about Family Voices of Minnesota. We are the state affiliate organization of Family Voices National, and we are also the state alliance member of Parent to Parent USA. So we are part of two different national organizations and networks. Family Voices of Minnesota has a parent-to-parent peer support program called Connected, and we provide information and assistance to help families get needed services and supports, including financial information, healthcare, educational, and information about community life. We connect parents one-on-one with veteran parents who have a child with similar needs or experiences. We offer emotional support, understanding, and acceptance so parents don't feel so alone. And we offer encouragement and education to support parents in speaking up for their child. All of our staff at Family Voices of Minnesota are parents who are raising children with disabilities and extra needs of many different kinds. So as I mentioned, we offer one-on-one connections with another parent. We also have a number of parent groups that we conduct throughout the month that allows parents an opportunity for networking and emotional support with other parents. We offer one of those networking groups per week. We have a resource-rich website, and you can actually chat with us live on our website, and the website is staffed by veteran parents. And we offer webinars like the one that we're offering today so that we can provide families with information to help them be advocates for their children. We also provide family leadership opportunities and training. We will have a Family Leadership Institute that will be starting in October, and we will be happy to provide some additional information about that. If you're interested, please feel free to email us or call us. As well as we have ongoing volunteer support parent trainings for parents who are interested in becoming a volunteer support parent. So let's get on to today's webinar. This is an important topic, and we're really happy to have Dr. Dennis Kuo with us today. Dennis comes to us with a very important and impressive bio. He's a primary care pediatrician. He is the Associate Professor of Pediatrics at the University of Buffalo and the Division Chief of General Pediatrics and Interim Chief of Developmental Pediatrics and Rehab at UBMD Pediatrics, Oishei Children's Hospital. A lot of Dennis's academic work has focused on family-centered care, family-identified health care needs. If there's any research that's done around children and youth with special health care needs, Dennis is often at the center of that research and has published a number of research articles that have been offered nationally. I've had the opportunity to work with Dennis on a number of different projects over many years. A couple of the things that I think are important to mention about what he brings to this discussion is that Dennis serves as one of the medical directors for Buffalo Public Schools in New York State. It's the second largest public school system in the state. And he's also a board member of Family Voices National. He brings a lot of personal as well as all of his professional credentials to the work that he does. So Dennis, thank you so much for taking the time to be with us today, and we look forward to the opportunity to learn from you and to talk about this important topic more.
Great, thanks, Carolyn, and hi, everybody. Good afternoon. It is just an absolute pleasure to be here. Carolyn and I have worked together for a number of years on different projects, and I'm always inspired by Carolyn and all of the work you do at Family Voices in Minnesota. I should also mention that one of my inspirations is my own 21-year-old daughter who has a special need and has been immunosuppressants for years, and who has gone through that healthcare transition and said, great, you know, I've got you as a parent. There's no way I wasn't going to get through this without getting it pounded in my head. So you can feel for her for that one. Let me get my screen shared and pull up my slides. As Carolyn mentioned, I'm a general academic pediatrician, and I also serve as one of the lead medical directors for Buffalo Public Schools. And I remember a year ago, as schools are starting to be open the first time, I actually gave a talk for our healthcare system here in Buffalo about how to open schools. And, you know, the landscape this year is different for a number of reasons. We have a lot more tools. We've got a lot more experience. And we also have to recognize that we've also let go as a country of a lot of the safety protocols from last year, and we've got to make sure we go back and adhere to them. Schools open in several weeks, right after Labor Day in New York State. I'm told that's the same with Minnesota. So we do have some time to be able to make sure that we do the right thing. So the objectives of this talk are, I'm going to start with an overview of really just safety in schools, especially from the COVID perspective, review the available guidance. And the guidance is really quite excellent at this point, and focus on special populations, subpopulation of children with special healthcare needs, disabilities, and medical complexity. I do want to reiterate that this is a high-level overview, and it's really impossible to cover every detail. My hope is that by going through this discussion, that we'll be able to approach your professional and personal school discussions with this framework, with evidence, and with a knowledge of how to be flexible. This is really intended to understand the framework, to know the evidence, to know the tools, to know the experience. And it's going to be heavily based on the existing CDC and AAP guidance. What I'm hearing both in New York State and around the country is people saying, well, let's just follow CDC and AAP guidance. Centers for Disease Control, American Academy of Pediatrics, they're excellent. They really are excellent. And if we follow them, the students will be fine. And some more take-home messages here, though, is you first have to start with what's in your community, you know, because if there's very little COVID in the community, the schools are going to be fine from a COVID perspective, almost no matter what you do. If they're high, you have to take precautions, and they're extremely high in most of the country. They're not extremely high in Minnesota, but they are rising rapidly in most places, and there are pockets where they're much higher. You have to implement and adjust layers of protection. We'll talk about what those layers are. Above all else, individuals should be masking, universal masking in schools. This really shouldn't be a question. The evidence and the experience is so strong that that just shouldn't even be a question. But other layers of protection include daily screening for symptoms, which is a code for saying if you're sick, you need to stay home. Distancing protocols, because distancing does make a difference. And consider screening testing of individuals who are asymptomatic. You're going to hear the word vaccinate, vaccinate, vaccinate throughout the entire presentation. Vaccines are a cornerstone of our strategy to keep students safe. Of course, a lot of our students cannot be vaccinated at this time, and so that is a reason why we have to do multi-layer protection. But to the extent that the general population that are eligible can be vaccinated, that is a major part of keeping students safe. And last but not least, that to be able to keep students safe in schools, we have to approach everything from a health equity lens. We have to make sure that all students have the right to a free, appropriate public education. All students have the right to be in school, and we have to do everything possible to make sure all of our students have that opportunity. And the only way we can do it is if we look at our subpopulations. What do we need to do to make sure that every child has that opportunity? A broad overview of this topic is that schools are a place for learning, and they also serve many other roles. They provide therapies, they provide childcare, they provide community support, and they play a substantial role in addressing racial and social inequity. And the Center for Disease Control and the American Academy of Pediatrics, they have called for school to be open for all children. We know that school, or compared to the rest of the communities, environments, schools are relatively safer, particularly when these layers of protection are in place. They're not just automatically safer, they're just safer because of how we can layer protections in place. Over the last 18 months, we have seen the effects that are quite devastating of what happens when so many kids miss in-person school. Kids who went remote, kids who went hybrid, for the vast majority of kids, it's just not the same. We saw a disproportionate effect on populations that are minoritized and populations with disabilities. The schools in the South opened earlier. We're seeing a ton of outbreaks in the southern states. They're done in the context of severe community outbreaks, but yes, you open up schools without layers of protection and there will be outbreaks in schools. So in the North, where the schools open later, it's decision time, decisions to be made by schools and decisions to be made by individuals at the individual level. What we know about children is that they don't typically get as sick as adults do, but we initially thought that there might be a lower incident rate. However, we now realize that over the last year, kids also didn't get sick as often because they just weren't out and about like the adults were. We have to recognize that much of the data that says schools are safe under these circumstances was also obtained from last year's experience. What was different about last year? We had different variants, we had different levels of contagiousness, and we also had incredible layers of protection in the schools. And we had a lot of students who weren't physically in schools at the time. We do know that children are more frequently asymptomatic or have mild symptoms compared to adults who get coronavirus. However, they can and do become sick. And as of the second week of July, we had more kids died of coronavirus than will die in 2 or 3 consecutive flu seasons in any given year. We also know that they do become disproportionately impact Black and Hispanic families. And we also know that underlying medical conditions are more commonly reported among children who are hospitalized. The ones that keep getting pointed out are children who are obese, children with significant pulmonary conditions, neurologic conditions, and cardiac conditions. At the beginning of the pandemic, it was reported that children, about 2% of cases would be children 18 and under. Right now, they're running about 15 to 20% of cases. The highest incidence right now across the country is in individuals between the ages of 20 and 40, but the incidence in kids are definitely increasing. So it is not accurate that children will not get sick. They can and frequently do. And when we let it spread among kids, you're going to get some pretty sick kids. The goal is that children benefit from being in person to school as a whole. We know that when children are away from school, we know that we interrupt supportive services. We know it leads to social isolation. We know it leads to food insecurity, and we know it leads to reduction in physical activity. We know about the disproportionate impact, and we know that schools are relying on last year's data. No Delta variant last year, no vaccinations through much of last year, and we had much stricter adherence to protocols. What we learned is that children under the right conditions can attend school safely, and they really suffered when they weren't in school. Think about learning, therapy, social, and mental health. What's coming up this year is that we expect children will attend school in much larger numbers. We have vaccines, we have testing, we have data, and we have experience. So to mention the testing, in New York State, when we opened the schools last year at the beginning of the fall, it was almost impossible to get a test in the community or get it. And if you could get a test in the community, you could only get a test result in about 4 to 5 days. The reason we couldn't get tests in the community, because all the supplies were being diverted to the southern states where they opened schools earlier and had outbreaks. We also know that in 2021, 2022, that we are starting this year with widespread community transmission greater than last year, and it's really caused by abandoning safety protocols. Delta is more contagious, but there's little evidence it is inherently more dangerous or uncontrollable. The virus transmission is still regarded as respiratory droplet. So basically the same precaution we took last year should work this year. Nothing has really changed about our understanding of how we limit spread. Masking and distancing does work. The vaccine is not 100%. No vaccine is ever 100%. And this reliance of this messaging that we had, particularly from the CDC, that if you're vaccinated, you can go out in public and not take any precautions and not mask, does not work. We know the vaccine does protect against severe illness. We know that for sure. But we now know that the vaccine in and of itself, without social distancing and masking precautions, will not prevent the spread of the Delta variant. The risk level in schools is highly, highly, highly determined by the community transmission. If there is little to no transmission in the community, that is your best protection. Your best protection is low community transmission. The reality is, however, that across the entire country, that's been pretty much thrown out the window. So the next best thing is that we have to have strong school protocols. When protocols are followed, transmission in school is lower. They do continue to parallel community transmission, but it is much, much safer. We also know that when you're at substantial or high levels of community transmission, experiences, particularly reports that came out of Michigan and Washington State, yes, they increased in schools and they parallel community transmission, but it is safer in the schools than just being outside. Historically, most cases happen staff to staff, but that doesn't mean that the kids are not at risk for catching COVID in schools. We also know that transmission in high school settings tend to be more common, which is not surprising because the transmission rate in the adolescents tend to parallel adults. Once you get over the age of 10, you tend to see contagious patterns and outbreaks that tend to parallel the adult setting. So that's something we need to consider when you look at elementary versus middle and high schools. So where we are now is just the level of community transmission is through the roof, and we have to start there. This report comes from the American Academy of Pediatrics and Children's Hospital Association, which says this is a number of COVID-19 cases that were diagnosed. This is actually not all 50 states. This is 49 states. And actually one of the states in there was New York State, actually only has New York City data. So I would just look at the trend here. And what the trend shows you is that we had a little bit of a spike in kids during the summer. It went down. We had a massive spike during the winter. It came down during the early midwinter. Then it went up again. Then it really dropped again. And now it's really rapidly rising again. And what I want you to notice is how quickly these cases have essentially doubled. And that tells you that there's a major spike in coming or happening in kids. I also want to focus on something called the community transmission levels. And I think folks have heard this in the news, the blue, the yellow, the orange, the red. And I think it's worth actually going over these levels. The Center for Disease Control, they classify community levels of transmission by these zones. And they're using the measure of the total number of cases per 100,000 persons over a 7-day period. I think it's important to recognize that 7-day period because reporting standards tend to kind of go up and down depending on things like weekends and when the data comes in. And so if you get it over 7 days, you get a better sense of what's really going on. So you want to make sure you pay attention to that number. But when you see total number of cases per 100,000 in a day, the way to figure out what's it going to look like in over 7 days is just multiply it by 7. You also see that the percentage of positive tests that are positive that are over the last 7 days, there you can see that low, medium, substantial, and high transmissions, if you go left to right, you can either go into these zones either by total number of cases per 100,000 in the past 7 days, or the percentage of positive tests over the past 7 days. And the reason you've got these two is because it protects against different levels of community transmission. So if you're under testing, you're going to get a much higher positive test rate, and you should use a positive test rate as your determinant of whether you're in the blue, yellow, orange, or red zone. If you have a lot of testing, and New York State is one of those states that does a ton of testing, your positive test rate is going to be lower, but you can rely much more strongly on your total number of cases per 100,000 in the past 7 days. So now you've got blue, yellow, orange, and red transmission zones. And what you do as a community, independent of how many people you vaccinated, because if it's in a community, it's in a community. What you do in a community differs on whether you're in low, moderate, substantial, or high transmission zones. When you're low, it means that there's not a whole lot of COVID in the community. You can pretty much go about your daily business without a whole lot of precautions, but when something pops up, you have to test, you have to trace it, and you have to isolate those cases. When you're in a yellow zone, you have to start adhering to individual and selected community level prevention strategies. To me, that means when you're in the moderate zone, you should start wearing masks. Substantial, orange zone, everyday activities should be limited to reduce spread and protect the healthcare system, which means that you have to start looking at distancing and reducing density. And at the high levels, in order to prevent major disasters in our healthcare system and access, you have to take significant measures and prioritize essential activities and services. And to me, that would mean preserving the ability to get healthcare and keeping schools open, and you've got to restrict a lot of other things. And one more thing I want to point out is when you go from left to right, the total new cases per 100,000 in the last 7 days, 0 to 10 for blue, 10 to 49 for moderate, yellow, 50 to 99 for substantial transmission, orange, and 100 for high transmission, red. And I can tell you that once you're in a red zone, cases are going to be popping up randomly everywhere because the spread is just uncontrolled in the community. Right now, Erie County, New York, which is Buffalo, is in orange transmission zone. And I can tell you that from the school perspective, we're just getting random students who are popping up left and right who are starting to be positive. So this slide comes from the Centers for Disease Control's COVID community map of counties and what zones they're in. And this map is actually now 3 days old because this is when I last put this slide together. You can see that pretty much the entire country from Iowa South, from the Dakotas West is red. Like everything is red. You've got some pockets of areas that are not red, but pretty much everything is red. Everything in the Southeast is red. Everything in Missouri is red. Pretty much all of Iowa is red. Everything south of Chicago is red. Everything in the West Coast is red. The Northeast is mostly orange or yellow, but that just tells you how much we've let this virus spread throughout the community again. You'll see that Minnesota right now is a patchwork of mostly orange and red. That means that there are pockets in Minnesota where there's widespread transmission. There are pockets in Minnesota where there's not widespread transmission, but there's substantial transmission. And so therefore, this is going to heavily impact school openings. Community spread absolutely appears to be the most important factor in determining safety reopening schools. If we were in a blue zone, you could open up without a whole lot of safety protocols and there would be no transmission in schools because there would be nothing in the community. But given that we have substantial transmission, deliberate planning and input from many stakeholders is needed for buy-in and commitment. We absolutely have to address the health and safety considerations for students and teachers and staff. We have to implement effective learning methods with continuity based on standards regarding the modality. And we have to address health and education equity and focus on special populations. So this slide here is, to me personally, was the most interesting and helpful way to categorize how we think about safety in schools. This is something that is used for hazardous substance control from OSHA. And I found this slide in the National Academy of Sciences reopening of K-12 schools during the pandemic. This is the hierarchy of hazard control. And it's an upside down pyramid, and it's from top to bottom, from broad to narrow. It's how do you keep yourself safe from a hazardous exposure? At the very top, the best thing you could do is eliminate or physically remove the hazard. And on the coronavirus, you have to get the actual infection, the actual virus to go away. And you do that by driving down the rate through mask, through vaccine or whatever needs are necessary to crush the curve. If you have the threat, the next layer is to substitute or replace the hazard. And in school openings, that means that instead of having in-person school, you do distance learning. The next layer going down to the yellow zone is engineering controls. And what you try to do is that you're going to have people in an environment where you're going to be exposed, but you try to physically engineer the environment so that you try to minimize the chance they're going to come in contact with the virus, in which case that means that you do ventilation controls and you do barriers to prevent people from actually coming in contact with the virus. The next layer, you go down to orange, is the administrative controls, which means that you have to control or change the way people work and interact. And that means that you have to hand wash. You have to walk down the hallways one way so that you don't face each other when you're in a dense environment. So you're literally changing in how people distance, you're changing the way people behave. At the very, very bottom of this, the smallest, the least effective way to control an outbreak is that you have to protect the worker with personal protective equipment, which means masks or face shields. So you cannot control an exposure without going through the hierarchy of controls. Obviously, eliminating is the hardest. A mask is the easiest physically, but you have to look at all of these things. And when you're assessing safety in school, you have to say, you know, if you can't eliminate it and you can't substitute it, you have to put more engineering and administrative controls and PPE controls in order to protect the student and the staff. So my interpretation of all this, you hear a lot of people saying, well, we have to get back to normal. You have to get back to normal. You have to get back to normal. That's really code for getting rid of substitution and maybe even the administrative controls, because we have to just pack people in classrooms and we have to just let people go without, you know, fear and just interact the way we did back in 2019. If you're lucky, you might still have the engineering layer, but, you know, there's only so much that like a rating, like a MERV rating of 15 can do to keep virus from being transmitted throughout the school. And we clearly haven't crushed the curve yet, because look at the outbreaks throughout the entire country and creeping up in Minnesota. And we know that a lot of kids can't be vaccinated yet, and we still have teachers and staff that aren't fully vaccinated. So you have to mask, and you have to maintain your administrative controls. I mean, that's just the bottom line, is that you have to mask and you have to maintain administrative controls. So let's go through the CDC guidelines. This is taken straight off the CDC guidelines that are available online. The reference is at the end of the presentation. I'm just going to read through some of the highlights. First highlight is you have to vaccinate as much as possible. The vaccine does reduce substantially the chances you're going to catch the coronavirus. It's going to reduce your time away from work or school if you do get sick. It's going to reduce your chance of going into the hospital. You have to promote vaccination. Point number 2, universal indoor masking. The CDC came out and said very, very strongly, schools need to universal indoor mask. And in the previous 2 slides, I have made my case why, from a framework perspective, students and staff and faculty need to mask regardless of whether you're vaccinated or not. Third point, a greater than or equal to 3-foot distance between students and classrooms. Adults still need to distance 6 feet. There is research showing that if you're 3 feet, but you are masked, that the outbreaks can be significantly limited. However, if you are at, like, say, if you go without a mask, that 3-foot thing is not going to work. Layered protection. Layers means that you have to have multiple ways of protecting administratively and engineering. Ventilation, pay attention to ventilation. Your schools should have your HVAC folks. They should have at this point gone through last year and saw where can we upgrade ventilation equipment, and every school approach building is different. Hand washing, sanitizers, respiratory etiquette. Make sure that students and staff and faculty, everybody knows that you have to cover your mouth when you cough and sneeze. Stay home when you are sick. Erie County DOH has told me repeatedly that there were outbreaks when people showed up when they're sick and were not vaccinated and or were not masked. The last thing in here is contact tracing. You should have a robust contact tracing program with your school and with your county or local health department. And the reason I put in assigned seating is because if you have a student that is sick and maybe without a mask, and you have a classroom that may or may not have been masked, and they're definitely not vaccinated because maybe they're 10 years old. If you know where that student is seated, you would quarantine only those that were within 6 feet of that student. If you don't know where that whole student is seated, you're going to quarantine the entire classroom, and that whole classroom is going to get shut down. So when you contact trace, you have to work with the public health authorities, and the more you can track where the students are, the easier it's going to be, and you don't have to shut the classroom down. A word about screening testing. So the Centers for Disease Control does have a section now where they encourage the use of screening testing to be able to see if there is COVID in the community and in the school population. Schools can opt for putting in place regular screening protocols, particularly for unvaccinated students, teachers, and staff. The CDC recommends, particularly in yellow, orange, and red zones, and they recommend weekly testing to see who is positive, who's in the community, and make sure that COVID does not get into the schools. The schools may have resources available to them. The federal administration has made available millions of dollars for states and communities to be able to set up screening tests, which are typically molecular or PCR swabs. Keep in mind that this is different from diagnostic testing. You'll hear about screening testing, which is you just look and see if you have COVID within an asymptomatic person. A diagnostic test, which you should get when you're sick, is basically if you have cold symptoms or congestion, you need to know if you have COVID. That is called a diagnostic test. The American Academy of Pediatrics guidelines, they also say, make sure you have as many vaccines as possible, vaccinate the eligible population as much as possible. The AAP says universal masking within schools. AAP says test, trace, and isolate. The AAP also says multi-pronged and layered approach. The American Academy of Pediatrics makes a big point in talking about special considerations, accommodations to account for the diversity of our youth, including the medically fragile and complex, developmentally challenged, and disabilities. And also to make sure that with our school protocols that we address the overall health and well-being of all children, adolescents, families, and communities. Let's go a little bit deeper into school considerations. When you are sick or when you're exposed, there are protocols that have to be followed. You hear about people who show up to school who have symptoms. That's a no. Schools really should be following as much as possible daily screeners and having a culture that says if you have symptoms, you need to stay out. You generally will need a negative COVID test and improving the symptoms to return. If you do not have a test, your protocols need to say you assume you have COVID and you stay out for 10 days from the start of symptoms. If you're exposed, current guidelines at the federal level are now saying if you're vaccinated, you may not have to quarantine unless you're symptomatic. However, you may want to heavily consider getting a COVID test within 2 to 3 days. Now, this is an updated recommendation because prior guidance from the CDC said get a COVID test 5 days after exposure because that's when you're likely to become positive when you're exposed. The Delta variant typically is showing symptoms faster and viral replication happens faster. So get tested within 2 to 3 days to see if you have come down with COVID. If you're unvaccinated and you're exposed, you're probably going to be quarantined and you should absolutely follow all state and local guidance, particularly if a contact tracer calls you and says you need to quarantine. Absolutely, please work with your local state health authorities because they will keep you safe. Another consideration, what if you've had COVID? Because a lot of people have had COVID. Follow up with your doctor to assess for any residual symptoms and assess for potential myocarditis symptoms, particularly helpful for kids, chest pain, shortness of breath, or fainting. If you've been sick for more than 4 days with fever or more than 1 week of fatigue, we really recommend that kids go be seen in person by their primary care physician. And if you're hospitalized, you really need a cardiology evaluation and restriction of activity, full activity for 3 to 6 months. There are guidance for return to play. So if you've got a student who had COVID, there are specific guidances within the references about when to return to play. And schools and school nurses and school administration should know what those guidances are. In general, if you're less than 12 years, you can go back to play in gym and in sports as tolerated. If you're 12 years or older, there should be a gradual return to play after you're cleared by your primary care doctor. Sports and COVID, there are higher risk activities and higher risk sports where you should consider closer monitoring for screening for symptoms, make sure you work with the health department, make sure you follow COVID protocols. Over the last year, we have found that the greatest risk in general for sports were wrestling, ice hockey, and basketball. Outdoor sports generally are not high transmission, they're low transmission. However, most transmission in these sports have actually not been on the field. They have absolutely been with the off-field activities that are related with these sports. ice hockey in particular, and ice hockey is pretty big in Buffalo. I understand how big it is in Minnesota. My daughter's roommates and best friend in college is from Minnesota and is a hockey player, and I've heard about it. Sharing meals, sharing equipment, transportation and vehicles, all of it en masse. So teams and coaches, they absolutely have to keep the COVID protocols going when they're not on the ice, when they're not in the field, when they're not in the arena. They have to make sure that their off-field activity adheres to protocols. Otherwise, the whole team's going to get quarantined when one person gets sick. Let's talk about children and youth with special healthcare needs. Number one, vaccinate, vaccinate, vaccinate. There's very, very, very few contraindications of vaccinating our children and youth. Obviously, age is a big one right now. Hopefully that will become less of a contraindication as we go through the fall. The AAP guidance talks about multi-pronged, multi-layered approach at baseline. The goal is to be creative, flexible, and responsive, but we have to keep the schools open and we have to get our kids in school. And we have to have a health equity lens on this. We have to advocate for inclusion. I recommend that you advocate for all of your students. What is it going to take to keep all of your students safe in school? You have students that are immunocompromised. You have students that are at higher risk for respiratory illnesses. You have students who are overweight. They have a higher incidence of getting severe COVID. Most children with special healthcare needs can safely attend school when protocols are followed. That we know. We have to follow the protocols. We want families, however, to know, I counsel my families, know your school protocols, know what's in the community, and engage in shared decision-making against what are your options. There are kids who are at risk for severe biological illness. That's what we're calling it. Kids who have a higher risk of ending up in a hospital or in the intensive care unit, and there needs to be shared decision-making. I don't think this is an either or. I want to see the kids in school, but you have to advocate for your highest level of layers of protection, including masks, especially masks. And as long as you know what layers of protections are there and it looks good to you, I highly, highly recommend that you feel comfortable sending your child to school. However, please use a framework, have a discussion with your school and your doctors, and take a look and see what's there before you make your decisions. Conditions for a consideration of school: vaccinate, vaccinate, vaccinate. We are working with our school districts to promote vaccines at the school setting, to work with the public health departments, to do in public health campaigns. That vaccines are a critical part to getting us through this pandemic and keeping our students and our teachers and our faculty safe. Look at your IEP, look at your 504s. Every time I do a checkup, I ask, when was your last IEP update? Does it account for compensatory services? Are they providing the services for you if you're getting home instruction? You have to look at compensatory services for learning, for therapies. I highly recommend a physician that you look at the mental health. Do you look at mental health counseling, either internal or external to the school setting, because this pandemic had a heck of an effect on our kids and our families. Slide. Sorry. Then, of course, we have our children and youth with special healthcare needs who are at the highest risk for getting biological illness. Vaccinate, vaccinate, vaccinate. Discuss with your doctor, discuss with the schools. The highest risk is lung disease, neurodevelopmental disability, cardiac disease, and obesity is on there. You know, like it comes up all the time in adolescents who are hospitalized. Take the community prevalence and safety procedures into account. Be creative, be flexible, and accommodate. You can ask for things like, is the classroom larger? Is it better ventilated? You know, some of the things we did in Buffalo Public Schools is that we look for the biggest classrooms available for our classrooms with kids with special needs. Look at the ventilation. Look at the ventilation at the school level. Less crowded indoor or outdoor spaces. Heighten your attention to PPE. And for personal protective equipment, in many cases, you're getting past universal masking to personal care levels, which needs masks, not only masks, but gowns, gloves, face shields, face masks. Pay attention to your surface cleaning and hand hygiene. Update your IEP based on current needs. If you have to go virtual, we recommend considering home aides and nursing to assist with learning and to arrange virtual and home-based therapies. And these are the questions that we want our families to ask when you're designing your care plans. Mask exemptions. That will come up. Almost all children can wear a mask or a face shield. we recommend when you're trying to get a child to wear a face mask that you use the approach of explaining that it's a mask, asking about the mask and saying, you know, can you wear a mask, model the mask wearing, and then find a comfortable mask. And when you get to that point of practicing with a mask, don't rush the process, but be consistent. If you get the mask to your face without putting it on, and then you last 5 seconds, that's better than not doing it at all. Just be consistent, practice it every day, and just little by little, you can get a child to wear a mask. Find out what the school policy and mask is. And the policy may differ based on the level of community transmission and whether the child is vaccinated. Sometimes they may say only kids who are unvaccinated may have to wear a mask. That said, yes, I recommend, highly recommend universal masking. But then you have to assess the level of risk and benefit of doing in-school versus home learning if you can't wear a mask. And again, think about the prevalence of COVID in the community, how often you can get a test, understanding the school protections, and in considering your places of exposure, not just the school, but also buses. And buses in Erie County, New York has been a source of outbreaks over the summer. This is just a small table about when you consider the risk. So if you go without a mask, what is the risk that you're taking? Think about the levels of coronavirus circulation in the community. Look at the policies, the potential for biological illness, the impact to mental health, including the isolation, and diminished access to learning and therapies with potential regression. However, look at the benefit of whichever path you take. If you're at home, do you have protection for illness? Do you have reduction of anxiety? Do you have an increased level of home care and potentially increase individual attention to specific therapies? And can you keep the learning plan consistent? Because it doesn't really do a whole lot of good if the school's opening and closing and opening and closing, and that's something you need to look for. The school does have responsibility for keeping kids and families and teachers and everyone safe. They have responsibility for your education, for appropriate public education. Make sure that IEPs are annually updated regardless of the learning or attendance modality, and make sure that families and caregivers are supported in adjusting the IEP plans and the goals as needed. All right. And the last thing I want to mention is I'm going to go to the elephant in the room. I have seen the Minnesota, the state guidance, which is that they highly recommend following CDC and AAP guidance. New York State is the same right now. There are states that have mandated certain protections, such as universal masking. There are states which are strongly recommending them. There are states that are resisting them. There are states with bans and mask mandates in schools, and there are school districts in these states that have fought back. My recommendation here is that there's a lot of this which is just going to go into local advocacy level. That in and of itself is okay. All public health is local. I get it. But this only works if you come with the facts, the research, the framework, and the discussion. Follow the available guidance. It's really, really, really good. So when you hear follow CDC guidance, follow AP guidance, it's good. It's good. It's based on evidence, it's based on experience, it's based on experts, and it works. You then have to take that and follow your community transmission levels, because right now, most of the country is very, very high COVID circulation. And so you absolutely have to put in these multi-layer protection levels, and you have to advocate for universal masking. And the last thing I want to mention is be good role models for your children. Kids are incredibly perceptive. If they see the adults wearing a mask, if they see the adults, paying attention to distancing, they pay attention to good behavior and how we communicate with our peers and our colleagues, they will do the same. Kids are incredibly resilient. They are incredible with their masking. They're not so much the issue. We have, as the adults, we have the ability to dictate how safe our kids are going to be. And I ask is that let's be role models for our kids, and let's get our kids in school safely. These are the main references. You can actually go through these references and pick out even more direct references, but I want to leave these here for you. I go by, at a high level, the American Academy of Pediatrics guidance, the Center for Disease Control, and the National Academy of Sciences is actually worth a read because it's got some really technical details, and the stuff in there is actually held up pretty well. Okay. think we got some time for questions. I'm happy to take some. So thank you for your attention and your interests.
Dennis, thank you so much. That was a ton of information, and I appreciate your time. We do have a question that came in privately in the chat, if I can ask that to you.
Sure.
The comment was that we live in a county with one of the lowest vaccination rates in Minnesota, and we're currently in the yellow/substantial category for community spread. Our district is not requiring masks. What are our rights? My daughter will likely be the only one wearing a mask. Will she be safe? Can I request her one-to-one para be vaccinated or wear a mask? We are desperate for help.
Yeah, and I'm hearing that. It's tough for me to comment specifically on like on a county or a school setting. I think, however, that the area of equity, of ensuring a free and appropriate public education is not an argument that I think people automatically recognize or come to. And as much as I'd hope that schools, districts, and counties will do the right thing and adhere to evidence and guidelines, I recognize that there are also places that are resisting. I think it is a conversation that has to be had, and I think that you go in and you have to advocate at the superintendent level for the rights and utilize. It is guidance, and there are rights, and I think people forget about that. Even in Erie County and even in Buffalo, New York, where we've had these discussions, there's a tension. Also, we've got fairly high rates here. We are in the substantial zone here in Erie County, and we're headed towards the red zone. And we have to also balance, for example, the masks, the lack of masks, and the protection of not just the students, but also the teachers and staff. One argument that I would actually make that I don't think people have recognized is that I think in the media, they have all talked about the people who are dying, and then they can talk about, well, kids don't die of coronavirus, which is not entirely true. But yes, kids don't die of coronavirus as frequently as adults do. But you have to think about the disruption, right? The disruption in learning, the disruption to school, disruption to your teachers, disruption to all of us who work and take care of our kids. And getting coronavirus as an adult is really not a walk in the park. You're talking about 2 to 3 weeks of feeling fluish, fatigue, and not to mention the long COVID. And I think you just got to lay it out there. It's the legality of all this depends on a somewhat Byzantine array of state and local guidance. In New York State, this is coming down to who's got a state of emergency, at the state and county level, and everything's sort of wrapped up in it right now. And I imagine the same thing would go on in Minnesota. And I do think that you're a little bit more handicapped in your arguments if the state does not, if the state has come out with following CDC and AAP guidelines. That inherently is okay. I have no problem with that inherently, but it also means that you have to put the hammer down at the local level, which can be hard because now you're talking about personal relationships and people you know. So my recommendation is have a conversation, make sure that you use the lens of my child has a right to be in school as any other child. The numbers will go up. You can advocate for routine testing because if people are not vaccinated, my argument is then, it's either you get vaccinated or you have routine testing, and you just got to keep going. I think people are not recognizing how disruptive it is, and you just have to keep up the pressure.
Thank you, Dennis. I want to welcome other people to unmute or raise their hands, but and I want to piggyback on the previous question and just ask, you used the term shared decision-making in your presentation, and not everyone is familiar with the phrase itself is lovely, but can you talk a little bit about what that might look like in the context of advocating for our kids as we return to school?
Absolutely. So shared decision-making at its core is a partnership, and it means that, folks who come to the table to decide, come with what their areas of expertise, and families comes with the expertise of families know what's best for their child and know their child better than anyone else, and come with a lived experience. And it recognizes that there may not be a right answer or an absolute answer, that you have to be creative and flexible, and you design it and you negotiate. Negotiating is one of the core tenets of shared decision making. I don't think that there's a one size fits all when it comes to what's right for a child. We have kids who actually did really well with remote learning. And at the same time, the kids who do really well with remote learning, some of them had anxiety disorders that were fine for a brief period of time, but we have to address, and that's when you have to say, okay, if we're going to do remote learning, we have to make sure we address mental health. So I would look at shared decision making as come as a partners, come in with your expertise, and be ready to negotiate.
Thank you. I am welcoming other people to unmute or chat if you want me to read your question out loud.
I can share at least some of our experience. We're in Southeast Minnesota in Red County right now. And I had planned to, last year during the pandemic, we transported our daughter because she wasn't old enough at that time, or our children at that time, because they weren't old enough to have the vaccine yet. And they stayed in the DCD classroom, so they weren't integrated with their peers in order to keep them safe. But this year I was hoping to integrate them back into the classroom. So we took those measures last year. One thing we learned was we also agree that masking does work, because Amanda's paraprofessional did get COVID during the school year and Amanda did not. So, in a way, to me, that proves that masking does work. So for that parent that wants to advocate for the masking, try as hard as you can, because it is, I think, a good way to, it's a very good level of hopefully prevention. So, but one of my concerns is now people in our community aren't believing in what the CDC is recommending anymore, because things have changed and other recommendations have changed. So when are we ever going to believe them? So how do we encourage them to listen to what the CDC has to say?
Yeah, that's a great question. And I also, and I see also the question in the chat about from Carolyn about the role of primary care providers. So I will get to that as well. I think this is an ongoing conversation, because what also changed, I think there's a few talking points as we have this conversation. The talking point is that Delta changed everything. Now, the reality is also that Delta changing everything also coincided with people who were rightfully tired of precautions, that we abandoned them. And this happened right at a time when a more contagious variant came in. I spent 8 years on the faculty at Arkansas Children's Hospital, and I still have a lot of colleagues there. And when that variant showed up and the school started overflowing with outbreaks and the Children's Hospital filled up, the conversation changed. Not enough, but it's definitely changing. The vaccinations are going up significantly. School districts there are implementing actually 2 school districts sued the state, and the state put an injunction against the ban of mask mandates, and the large school districts are putting in mask mandates now, 2 weeks, 1 to 2 weeks after the schools opened. My discussion points are, you have to look at what's going on in the southern United States, because they were kind of the test case of what happened, and the cases were exploding. I think people forget that it is about the deaths, but it's actually more importantly about keeping your kids safely in school and the lack of the disruption. I think people are starting to understand that this is really about community transmission and not just about the vaccination. I think there are some options, including whether there should be regular testing if you don't want to mandate vaccines for staff and teachers, because that's another hot topic. And there are places that had to they got attorneys, and they forced changes because they felt like that was where they needed to go for inclusion. Now, obviously, I don't want to go that far. I'd rather folks have that discussion, but I think that this all started with a confusing message from the CDC, which should not be confusing anymore. People were tired, and people thought that masks were not necessary because kids seemed like they weren't getting it. And I think we used to say that. That was last year's data. Right now, the data is coming out of the South, and it looks like you have to put masks on in school, and then you just got to keep it up. And it's exhausting. You know, it's absolutely exhausting. But I encourage folks to just keep it going, keep it going, keep it going. Carolyn, the role of primary care providers. You know, the primary care providers, several things. One is that I think the primary care provider can absolutely help assess the level of medical risk, especially for the kids who are at the highest risk for biological illness. Number two is that I think the primary care provider should be helping with connecting with mental health resources because, you know, in addition to many of our children with special healthcare needs, and the families dealing with stress and adjustment, there's a lot of comorbid mental health conditions and diagnoses that need to be addressed that we need to recognize. Number three is that I would encourage folks to assess the level of anything from mask exemptions, if that is deemed the right thing to do to get our kids in school. And I will say that mask exemptions are not necessarily the right way to go because most kids can wear masks, but I think you have to assess that possibility and work with the schools in that. And I would also encourage looking over that in the context of the IEP to be able to put together, you know, this is what happens when you miss therapies. This is what happens when you miss your routine, because we saw a lot of kids who, like, when you put together what they should have been getting through their IEP and you see what happens to medically, you can put the whole story together. So that's how I would recommend that PCPs advocate for the kids, because they can put a lot of that story together. I'm just looking through the chat.
Yeah, I wonder if we want to take one more and then maybe address anything else offline, just to be considerate of time.
Yeah. To answer what's going on in Buffalo is that this year, the school districts here are only utilizing distance learning for if you have medical exemptions or homeschool or homebound medical exemptions. I actually think it's an issue because last year, whereas we were really trying, the school district really trying to keep kind of equal opportunity for learning, this year, it's definitely not equal. And I think that's a problem that we have to work through. But the way we're dealing with this, we have to push for kids have to be safe in school. Mandating schools masks for those at risk. You know, you have to look through the ventilation at school, and hopefully the schools have assessed ventilation. I think given the time, I'm happy to do follow-ups for this plus any other questions may come through, because it's kind of a politically fraught issue as we kind of balance inclusion and safety for all. Thanks.
Dennis, thank you so much for presenting today. And thank you so much to everyone for joining us. There will be a follow-up email that will have a PDF of slides, as well as a link to a survey that I'm just dropping in the chat right now. And then feel free to respond to that email if you have follow-up questions, so that I can share them with Dennis and get responses out to you. But speaking of politically fraught, I know that it takes a lot to weed through all of that and with the data and information. So I appreciate you putting on that hat today and sharing with us.
Absolutely, my pleasure. Thank you again for the opportunity. As I said, if there are any follow-up questions, just let me know.
Sure will.
Okay.
Bye.
Bye, everybody.
Bye, everybody.
Bye.